Well, I have the pleasure of rounding off the, I think this is the 6th Big Data conference that we've had now in precision medicine. We used to be in biomedicine. We're now all much more precise than we used to be. I should have do I have a clicker? Does anyone have that? We have a tradition here at the Big Data conference in finishing with a very quick review of the conference in tweets. And if I get a clicker, I'll show you them. Oh, wait, you see it, someone? Oh, let's play Hunt the Clicker. Oh, there it is. Perfect. Okay, but before we do that, there's a much more important thing to do, which is that, no conference at all, never mind one of this complexity, gets put together without a great deal of help. And although there are some faculty members involved, mostly in helping try to sculpt the topics, as you can guess, absolutely all of the work is done by a team behind the scenes. And so, first of all, I'd like you to join me in thanking the team, and that is from the Dean's office, Janet, Emily, Anna, and I missed one. No. Kelly, thank you. I'm so sorry. Kelly, you get a special mention. So, and then also the group behind the scenes that have been doing our AV, please give them a quick round of applause as well. Thank you. I hope you have enjoyed coming. Here is the conference in 2 minutes, here at least on Twitter anyway. 550 people over a couple of days here in person, which is great. 2,500 viewers on the live stream. So one of the things we're most proud about the conference is that the live stream, of course, is free and available. The videos from the individual talks will be made available also over the next few weeks and months. If you're interested in prior seasons, prior Big Data conference videos, then they're also available on the bigdata.stanford.edu website. So here we are. First of all, some people were excited to come back. We're happy about that. We had a good lineup of speakers, I'm sure you'll agree. We started with Eric Dishman, of course. What an inspiring story of his life. I mean, I think to be told that you have, only a few months to live, age 19, and as he said, 30 years later, having run health innovation at Intel, now to be in charge of the All of Us research project, really an incredibly inspiring story and one of many that we've heard. One of the things we try to do with the conference, I hope you'll agree that we have succeeded, is create the patient stories as well as bringing the technology and trying to make the personal part of it as well. Something that was very personal, of course, as you remember, to Eric, was his relationship with Andy Grove, and I think there were several others in the audience who remember the former CEO of Intel. So we talked about, one of the things I was most happy about this year was that we had represented the All of Us project, also UK Biobank that many of us use already, but also Project Baseline, all together kind of in one place, and having the opportunity to see those teams talk to each other and share. I think it was a really great experience for us to be able to have brought them together. We also are very eager to make sure that we have good diversity represented both on stage and in the talks, and so this was very nice to see this particular tweet relating to every speaker addressing health equity and also the diversity across populations. Some of you know I'm a big fan of fiber, so even though I'm not a microbiome person, I'm always happy if we're talking microbiome, and it is possible to have a high fiber diet, not just through Fiber One, but through many other approaches. I am not paid by Fiber One. It's important to know that. Rory Collins, of course, from UK Biobank was here, and this is one of his, this is almost a meme, this slide that is tweeted here. This is such a compelling figure for the general concept of big data. He said, of course, he's a big fan of big data, but he's also a fan of imprecise medicine, as he defined it. So this is something that is a really compelling reason for moving to larger data sets, because we get smaller error bars. How could we not celebrate the blockchain symposium, and thanks to Carlos for putting that together and for chairing what became one of the more surreal ones, as well as being very exciting and something on the cutting edge. A lot of people were saying they were really happy to hear, because they'd heard so much about it, but they really didn't know what it was, and that they were really grateful to each of the speakers for taking their own way of explaining it. So you'll also remember, if you were at that one, that it did become the most surreal because we had a moose that was in a boat or not in a boat, and then there was a mouse that was in a boat or not in a boat, and then we had a question from this person who then became known as a wizard if you were here. He also asked a question today. He may still be here. So we were happy to see that. And then there was somebody in a kilt, you'll notice, and it wasn't me. So I was delighted to meet someone else wearing a kilt. And I don't know if he's still here, but thanks for bringing Scottish formal wear to Big Data and Biomedicine. I have failed over 6 years to do that. Next year, yeah, we have a chance to get there next year. Okay, and this was really inspiring. We're on to today's talks now, and to hear from Geraldine about PMS and her journey and her story with her kids was just amazing. I couldn't do better than this tweet. She tells a beautiful personal story about her family's journey with PMS and the power of patient advocacy in rare disease research. We've been trying to bring a rare disease symposium or seminar to the Big Data conference for the last few years, so I was really delighted that we were able to do it today, and I think it was, sitting down there, I just loved sitting and listening to it, so I enjoyed it. And then we had the first live diagnosis on stage. I was happy about that. I think we may try and do more demos, since that one seemed to work. Higher complexity, but people like to see dangling on tightropes. So this was live diagnosis. And I think that the message there, though, was really compelling, which is that technology really can reach across this diverse group, outside of the bubble that we live in here in Silicon Valley, but to reach the rest of the world. And I think we need to keep that at the front of our minds, the enabling power of technology globally. As Andrew himself noted, AI is the new electricity. I hope he convinced you of that. Certainly, I think it was a pretty impressive demonstration of what is possible. There were a few laughs in the room when he told us that deep learning is just simply rebranding of the term neural network. I think a few people that suddenly clicked and made sense. Maybe big data was a rebranding of statistics. My colleagues tell me that. So we're good at branding as well. That's okay. We can do branding. This was a great talk from Jen. Of course, she started with basketball. We were excited. I thought the whole thing was going to be about Steph Curry there, but hopefully one day. But of course, the combination of really bringing tools and technologies from different verticals and applying them to healthcare was a theme that we saw in many talks, and she really did a great job of bringing that together. And then Regina, this is a great reformulation of that quote. I don't normally do crystal ball predictions, but the future is what we decide to build. I think that's a very Silicon Valley ideal, and it's something that I think you saw personified in many places in the conference. But at the end of the day, this, I think, was really the summary for us, and what we really feel is the most important thing. Because for all that we focus on technology and what it can do and what it can bring, and the data that technology can provide and what that can do, at the end of the day, it's the patient that is the heart. So keeping the patient at the heart of digital health, we sometimes need to be reminded it's all about the patients. I'd like to leave you with that. Wish you safe travels. Thank you so much for being with us this year. We will see you next year. Thank you.